Hi, I'm Dr. Mark DeBrincat, and I have been a chiropractor for 28 years, and I've always been very passionate about sharing the truth of what chiropractic is. And so today I wanted to share with you something that you may have not heard before, a little bit different approach to understanding the truth behind chiropractic. So all of us chiropractors can basically be divided into two categories, a wellness chiropractor or a corrective care chiropractor. Now, I like to use the analogy of a dentist versus an orthodontist. The dentist deals with hygiene and keeps your mouth clean and your teeth clean and prevents decay, and the orthodontist is actually changing the structure. So I'm one of those chiropractors that works at changing the structure because then you become stable and actually don't need to be seen quite as often. So with that, let's talk about what a stable spine looks like. Now, we like to take x-rays and look at the whole spine in one shot. This tells us the truth about where you're bearing your weight. And so we can understand gravity and physics. Wherever you bear weight in an awkward position, you're going to degenerate or wear out that area faster than the rest. So when we look at a view from the front, this is an A to P view of the spine, we can see we have a gravity center line going through the middle of that x-ray. Now it's perpendicular to the top of both femur heads, or the top of your legs, and then it goes perpendicular right through the middle of that sacrum. Now in a healthy spine, we should go through the middle of the top bone in the neck and also the middle of the pelvis here at the bottom. So here's a perfect example of how the body adapts whenever you come off that center of gravity line. We can see here that we're centered through the middle of the pelvis at the bottom. But once we get to the lower back here, this wedge brings that spine off to the left of center. Then it quickly adapts and it shoots off to the right of center. So at the top, we're not on that center line. We're about an inch off to the right. And so this is two different ways that the body has adapted. So in corrective care, we start treating the bottom vertebra where it first comes off the line and pretty much leave the rest alone. So this is what's happened after a few visits. So now we can see we're still on the center at the bottom and we still come off here, but what's happened is we stay off to the left of that line and we're starting to migrate over to get on that line. So instead of having two separate adaptations, we're down to just one now. So let's see what happens when we go just a little bit further. So this is when we've finally found the center of gravity line. We can see that it's still centered at the bottom, and then we come up and we're right on the smack dab middle at the top. So at this point, all the muscles right to left stop playing tug of war and they stop fighting and keeping all your spinal muscles so tense. So once we've accomplished perfect center of gravity on the front view, then we take our attention and we look at the side view. Now here it's important to understand that we're supposed to have three curves in our spine. Each of these curves are 60 degrees in nature. We have a 60-degree neck curve. We also have the mid-back that goes the opposite direction, and then our low back comes around the same way as our neck does. Now we also have our ear, the middle of our shoulder, and the bottom middle of our hip should also be on the same plumb line from the side view. We don't want to see somebody's head translating forward and forward like we see so many times. So something us chiropractors also pay attention to is having the proper curve in our neck and how the baseline of each of those vertebrae, when we draw lines, comes back to one point, like spokes on a wheel. Now it's important to understand that that curve in your neck has two functions. Number one, it's allowing all the vertebrae to interlock with the bone above and stand on the bone below, so the weight of the head is distributed on the skeleton. That's super important. The other aspect is that curve is designed to protect you in the event of an injury. If you have whiplash and your head gets thrown back and forth, that curve is the first part of that stability in the neck that's going to save you and protect the soft tissue. Once the curve is gone, then the ligaments that hold the neck together are torn, then the disc rupture, then the bones break, and then the vertebra or the spinal cord is actually damaged last. So it always happens in that order according to the strength of the tissues. So having the curve is really so important and to protect you in the event that you did have a trauma. But it also protects the bones so we don't have arthritis and we can actually live our entire life without restrictions in our neck or pain in the neck as well. So let me show you what happens when we have an injury and things don't look so normal. So we talked about the importance of having that curve in your neck. When we see here, this neck is completely straight. So the weight of the head is no longer on the skeleton, but on the disc, which is the little bag of water in between each vertebra. Now it's not designed to hold the weight of your head for too long before it starts migrating and pushing in a certain direction. In this case, it pushes straight backwards where your spinal cord is. So we can see here at the top vertebra, there's a space that's open front and back. That's healthy. That's how our joint should look. As we come down the spine, we see in the back where all these arrows are, a bunch of bone spurs that are growing together, forming a wall in the back of the spinal column. This is doing that to protect you because if that disc goes into the spinal cord, you're going to feel like somebody stabbed you right in the neck and you're going to be useless to do anything the rest of the day. Now, arthritis will grow pretty quickly in there, form a wall of bone, and in doing so, it's going to compromise the neurology going to your hands and your arms. So you'll have weak strength. You'll also have maybe numbness or tingling in your arms, but that's a way that the central nervous system protects itself and sacrifices the peripheral nervous system in order to you to still have a life and be able to go and do. Now, here's what's interesting. None of these lines are coming together anymore as far as I draw them out, which means that there's no curve in the neck, which also means that that weight bearing is in the wrong place. Now let's look at the low back. When we come down here, the back of all these vertebrae are supposed to line up in one line. This happens when there's a physical trauma and the ligaments are torn. 100% of the time it has to be a fall or a car accident or a slip of some sort. Now, again, in corrective care, we're going to pick one vertebra in the bottom of the spine. That's the most unstable. That's the primary segment. We're also going to pick one vertebra in the neck that's also bearing most of the weight. That's the primary segment. And this is what happens when we leave the rest of the spine alone and only address those two primary areas. Now I'll say that this was accomplished at twice a week for 12 weeks. So there was 24 chiropractic adjustments and some exercises that she did at the same time in order to bring stability back to this spine. And once we've achieved this, we've released her from care. So we find it, fix it, and then leave him alone. Okay? So when we look at the neck here, we see a beautiful curve has come back into the neck. All these lines are now appearing to come together to a single point, just like we wanted. But what's most impressive is the back of all these vertebrae where we saw a bunch of arthritis and these bone walls growing together. Those have all been reabsorbed. That's correct. The body will reabsorb that bone as fast as it puts it in there as soon as it feels that it's no longer a threat in that area. Now let's look at the low back. By adjusting just the primary segment and doing some exercises, we were able to bring all of those vertebrae back into one tight line. So all that stair-stepping that you saw in the previous x-ray has been healed. So once the spine is stable and the weight bearing is in the proper place, it's not necessary to be adjusted all the time. You'll be so in tune with yourself that you'll know exactly when something's not right. And the sooner you can get in for your adjustment, the longer you'll hold that adjustment. Now, I do want to mention that if you are ever injured, whether it's a slip and a fall or an accident, something that you think, okay, I'm probably going to feel that one tomorrow, it's important that you try to get a hold of your chiropractor within that first hour. That's a golden hour before scar tissue and everything else sets in. Past that first hour, within the first 24 hours, we can still get you better within a couple weeks and get you back to stability again. Once it's been more than 3 days, then it takes us 2 to 3 months again of going through the entire protocol to bring stability back where there is so much scar tissue that has already been laid in. So there's definitely an importance to how soon you can get in to see your chiropractor after you've had an injury. But also ask questions like the things that I brought up today. Find out what's their plan for you. Are they beginning with the end in mind? Saying, here's where the instability is, we're going to treat you to bring stability back to that area, then we're going to take an x-ray just to prove that it's actually stable and then release you from care. This is the type of chiropractor that I would personally go see, somebody that actually has a plan to correct the problem, bring stability, and then release me from care. So with that, I hope that was informative for you. I hope you learned a little bit more about the truth of the different types of chiropractors, because there's so much diversity in our field. We have lots of different philosophies and methods to move the bone back into its proper position and to free up the nervous system. But inevitably, we're all doing exactly that. It's so much easier to let the body heal itself by freeing up that nervous system and bringing stability back to our joints than it is to ignore it and then deal with limitations and possibly diseases that are unnecessary for the rest of your life. So with that, I hope you have an amazing day, and I hope that now you can appreciate chiropractic maybe just a little bit more than you did before.